Well, you're very welcome to today's talk. It's Sunday the 16th of May. Now, we've got some news from the United States and the UK mostly today and a little bit from India. But I want to start off with some orientation, which is always useful to remind us roughly of where we are on the international sort of comparisons. So here we have the main English-speaking countries. Australia and New Zealand, of course, with the lowest number of cases per capita. Now, the UK, the numbers are going up very slightly, and more on that later on. Ireland, it's good to see that they're still going down, flattish to going down. The United States, the trajectory is good. Canada, the trajectory is good. But definite hiccups starting to appear in the US vaccination program, which we might talk about in a minute, where, of course, in the United States, the demand is now slackening off, unfortunately, and they're nowhere near what I would consider to be herd immunity levels yet. Europe, United Kingdom, Portugal, down at the bottom there. Germany, Spain, Italy, Belgium, France, Greece, Netherlands and Sweden with the highest number of cases. But I think you would agree that the general trend there in Europe is down, which is good. But of course, the India variant is probably spreading there as we speak, which could make a difference to the number of cases. But as of now, Sunday the 16th of May, that's all we can say. Definitely, that's where we're currently at. I am actually expecting these cases to go up when the India variant starts spreading, as we are going to get in the UK as well. More on that in a minute. I don't want that one just now. So that's that one. Now this is data from Israel, share of the population fully vaccinated against COVID-19. So it's round about 60%. Now, there has been a lot of cases in Israel, so we can assume that the natural immunity plus the vaccination has given rise to, say, 70% of the population having a fair degree of protection. And remember, that is that is 60%, round about 60% fully vaccinated. But it's not really quite as high as I would have expected that we need for the benefit that we're seeing in Israel. So that's the vaccination status, fully vaccinated people. And they're the new daily confirmed cases. So they've gone way down. They're quite a bit lower than in the UK, quite a lot lower than in the UK at the moment. And thankfully as well, the number of deaths from COVID-19 has dramatically dropped off as well. So I put that Israel slide up there really for showing us what's in the future for higher levels of vaccine. But it is surprising that the benefits in Israel are as good as they are for the levels of vaccination I would have expected, 70 or 80 or 85% even required for those levels of benefit. But I'm not knocking it. They are the figures. Now, going on to the United States, first of all today, just briefly. United States, fully vaccinated people, of course, do not need to wear masks for indoor or outdoor activity. But this is based on an honour system. So it's a bit strange, really. So the FDA have kind of said, well, you can take your masks off in public places and indoors if you're fully vaccinated and it's at least 2 weeks since your last vaccine, since your second vaccine. But there's no authorization of this. There's no apps or certificates or anything. And the problem is, in the United States, mask wearing has been politicized because we had that saying for ages, masks are critical, not political. So it's a bit of a strange system in the United States. So if someone's not wearing a mask, does that mean they're fully vaccinated? Well, you would certainly hope so. Or does it mean they're making a bit of a political statement, which would be unfortunate? So I think it's fair to say the situation is confused at the moment. So you see politicians and things outside not wearing masks because it's 2 weeks after the last vaccine. Fair enough. But other people who have not been vaccinated. And we know in the United States at the moment there's many more vaccines available than there are people turning up to take them. So at the start of this programme, the sort of slogan in the States and everywhere was never waste a vaccine because we're short of the vaccine. The stuff like gold. That's why I got mine early, because we don't want to waste any. We were calling round to make sure you use all the full allowance for the day. Whereas in the United States now, they've changed the slogan to never waste an arm. So if someone is there with an arm to inject it into, vaccine vials are being opened, even though they might not be able to finish using the vial. Now, I'm not saying it's given rise to big wastage, it's not, but it just illustrates the way that the limiting factor now in the United States is demand for the vaccine. And the numbers vaccinated in the States are not yet high enough. It's that simple. So demand needs to keep going in the States, otherwise there's problems ahead. One of which may be this indeed. Iowa. Now, yesterday we quoted from the Centers for Disease Control website, and we said there was none of the Indian variant was there in the States. Now, of course, we knew it wasn't true because we know it's in the States, but it's not on the CDC's website. And I was taking that live from the website, so it's not on the website. So Centers for Disease Control website, well out of date. Not impressive, actually, for a country like the United States to have a CDC website as out of date as that, because we know that there's quite a few cases. Now, people have written in for many parts of the state saying, no, well, I'm afraid we've got some here. We've got the India variant in my state. But just to give one documented example, that's the site from the Iowa Government Department of Health site. And there's 2 cases of B1617. Now, we don't know whether it's the 0.2 or not. We don't know that. But it does show that the India variant is definitively in the States. We don't know anything about these, whether they're travel related or not, but I've had reports from many of you from many parts of the state saying it is in your state. So we know it's in the States, CDC is out of date. And we know it is spreading more aggressively, shall we say, than other variants. So the prevalence of this will increase. In the United Kingdom, it's still increasing exponentially. It's doubling every week at the moment. Now, just to briefly India before we go on to look at some news from the UK. Indian villages. Now, the virus now it seems to be well established in Indian villages. Now, smaller Indian villages may have no healthcare provision at all. Slightly larger villages or smaller towns may have a very basic healthcare clinic. It may or may not be staffed by competent staff. There may be a nurse, there may be a pharmacist. If you're lucky, there'll be a doctor. But very often there's not. And as for oxygen facilities and things in the villages, it's simply not there. So it's very concerning that this is spreading into the villages now. Now, 65% of the population in India live in rural areas, and that's well over 1.3 billion people, well over that. Very, very limited testing. Now, there are government teams going round to some villages with some tests, but it is just so obvious from the reports we're reading that the virus is grossly underdiagnosed in Indian villages, in rural settings. But the positivity rates where it is coming back is 10%, which is high, meaning there's a lot of community transmission. So just to take one state, for example, Uttar Pradesh, 230 million people. It's reported that 700 teachers have died after the elections. Now, in Uttar Pradesh, and I think in other states in India, what happens is that teachers kind of double up as election monitors. They kind of run the elections in areas of the cities and in the towns. And these elections went ahead along with the religious festivals, and it's reported in Uttar Pradesh, okay, it's a large population, it's 230 million people, but it's reported that 700 teachers have died after supervising the elections. And if 700 people have died, then at least 30 times that, we would assume, have been infected. So we have these behavioural factors that are causing the spread in India, but we now also know that the intrinsic biology of the virus is more transmissible. We looked at that data yesterday from the UK. So basically in Indian villages now, thousands of people are dying through lack of basic healthcare provision. They don't have cars, they can't just jump in a car and drive to a hospital. If they did, they probably couldn't get in. Private hospitals are completely unaffordable to most people, and it's just terrible. Many, many thousands of people, we believe, are dying through lack of basic healthcare. And the cases are simply not being registered because the testing is not there. Now, moving on to the UK, quite a few interesting things to look at here. Now, start off with Matt Hancock, the Secretary of Cabinet Secretary for Health, of course. So direct quotes from his latest interview: I think it's quite likely this will become the dominant variant. So the Indian variant, unfortunately, is going to become the dominant variant in the UK. We believe it's going to replace the B117 because it's outcompeting it. This is simple evolution. The fittest virus is surviving and propagating. So the dominant strain in the UK is becoming the India variant, just as the B117 UK Kent variant outcompeted the previous variant. Now it's in turn being outcompeted. So that is currently happening as we speak. How many cases of the India variant are there in the UK at the moment? We don't know. It was just over 1,300 officially diagnosed, but that's pretty well double on the week. So what we know is the numbers are increasing exponentially, doubling every week. Important for people coming forward for testing. So yes, people have to come forward for testing. And being careful, this isn't over yet. Now, of course, tomorrow we've got this huge opening up in the UK. Massive opening up tomorrow, so indoor. You can meet your friends in their houses. You can go inside a pub or a restaurant for a drink or a meal. This is going to cause an increase in cases. There's no question about it. And where the Indian variant is there, the rate of growth is going to be even greater. It could be doubling every 3 or 4 days, the India variant. So this is going to accelerate. This is what is going to happen. It's pretty well, it is inevitable. Now, Matt Hancock again, we have increasing confidence that the variant works. We have increasing confidence that the vaccine works against the variant. So what he's saying here is the vaccines we have now are going to be effective. But of course, not everyone is vaccinated yet, and not everyone has had the time for the vaccines to generate the immunological response that we need. We just needed that extra few weeks, really. Now, the reason he's saying that the vaccine works is early lab data from Oxford University. So Oxford University have looked at the vaccines that we have, looked at the immune response, they've looked at the virus, and scientifically that they have concluded that the vaccine should still be effective. Maybe not as effective, but still effective. So that is encouraging, but of course that's not based on epidemiological data, that's based on lab data at the moment, as my microphone falls over. The strategy is on track, it's just that the virus has just gained a bit of pace. Well, yeah, you could say that. And we're there, and we've therefore all got to be a bit much more careful and cautious. Not very good grammar, but that's the way he said it. Okay, so yes, but we're opening up on Monday. This is the problem. So we need to open up carefully, I suppose, is the moral of the story. That's what he's trying to say. As of next week, over 35s will be able to get vaccinated. Not yet, but sometime next week that's going to start happening. Now, a big concern is this virus going to make the patients sicker who get it? Well, there's patients in Bolton Hospital at the moment, which is the epicentre of this in the UK, due to travel to and from India. I'm not going to go on about this. We warned against it. Well, it must be 6 weeks ago now. Just for a change, everything was ignored. Flights carried on as normal. People going back and forth to India for what I would consider frivolous reasons. India, Pakistan, Bangladesh area. But now, anyway, it's there. That's history now. The vast majority of patients in hospital were eligible for the vaccine but did not take it up. So if this is not a reason to get vaccinated, I don't know what is. So most people in Bolton Hospital at the moment, the vast majority of patients were eligible for the vaccine. That means they were old enough for the vaccine, but they didn't take it up. So we now have older people suffering from the India variant in Bolton hospitals, and therefore they are at risk because they didn't get vaccinated. Also, they could have spread the disease around to others who were not infected. So not only have these people got sick themselves, they probably spread the virus around. I'm trying to restrain not getting cross here. 5 people have had a single jab, hospitalised, India variant, Bolton in England. So we don't know how long after the first jab they were, but there's a few who've had one vaccine dose. One patient who's received 2 doses of vaccine, but Matt Hancock described that person as being frail. No deaths so far. Localised lockdowns not ruled out. Next decision day, 14th of June for the 21st of June, when things are supposed to be getting basically back to normal. So we're 16th of May now. Next decision date, 14th of June. By that time, the India variant will be the dominant variant in the UK, and I don't really see how we can have full opening up on the 21st of June. But I am hopeful that there's not going to be a massive increase in people getting very sick and dying, because the vaccines are catching up. We're just not quite there yet, but we are doing well. Countries like Europe, Ireland, where the vaccinations are behind, that they're going to have more significant problems with people being hospitalised with the India variant. Therefore, I'm expecting to see increasing hospitalisations in European countries over the next month or 2, I'm afraid, before their vaccine programme catches up. Roughly, they're about a month behind. And that's going to make the difference for some people, I'm afraid. COVID symptom study, always worth a listen, Professor Spector. Best to listen to it directly from Tim, actually, get it straight from him. But anyway, a quick resume of it. Is COVID changing? Well, it is. The presentation's changing because of the vaccination. So asymptomatic rate is higher after the vaccine. So most patients who get the infection after vaccine, it's the minority that do, but the ones that are largely asymptomatic, or the symptoms may be very mild. They have fewer symptoms, and the symptoms are for shorter duration. So all good reasons to get vaccinated. And they think that they're less likely to develop long COVID. And I'm sure that is going to be the case as well, because it's a much milder illness. A vaccine is leading to lower transmission of the virus, and all of these effects are greater after 2 doses. So after 2 doses, the symptoms are even milder. There's even fewer symptoms. The symptoms last for even a shorter period of time, and probably even less likely to develop long COVID. Now, symptoms after vaccination. People with no vaccines in the first week, we know from the COVID symptom study data, had an average of 5 symptoms in the first week. An average of 5 symptoms. First dose people who've had 1 dose, if they get infection, they're down to 2 to 4 symptoms. People that had the second dose as well, they get 0, in other words, they're asymptomatic, to 1 symptom. So very, very mild, and a lot of people won't even realise that they've had it. So that's why it's important to get tested if you suspect you have. So again, remarkably encouraging chains of evidence there for the efficacy of vaccination. The people in hospital in Bolton now, the vast majority of them have not been vaccinated. But before they were hospitalised, they had time to spread it, as we've said. Right, so personal reasons to get vaccinated. So self-interest reasons to get vaccinated if people aren't community minded enough to increase herd immunity. Now, start of Moderna vaccine, of course, in the UK, first of all, we had Pfizer, then we had Oxford AstraZeneca, then the Moderna, and 6,900 reported people have so reported that they've had the Moderna vaccine who are on the COVID symptom study, which, of course, we encourage everyone to be on. And so far, the data is looking like the side effect profiles similar to Pfizer. Short, limited side effects, or sore arm, maybe not feeling right for 24 hours. But age difference in the side effects, again, repeated as in the Pfizer, with younger people getting more side effects than older people. Tim Spector mentioned they're having to adjust their data because 80% of app users have been vaccinated. So the amount of people that are using the app that have been vaccinated is higher than the general population, because, of course, people using the app are taking an interest and presumably are somewhat older because it's the older age groups that have been vaccinated. But what he's saying is they're adjusting the data to account for that. Cases slightly up in the past week, mostly mild due to younger age groups or people that have been vaccinated. So although the cases are up, these are mostly mild, although there are some people hospitalised, as we've seen, because the infection is now spreading in younger unvaccinated people or people who've had vaccines, therefore generally or virtually always very, very much milder. Now, risk of catching COVID in the UK over the next 24 hours, if you're unvaccinated, 1 in 16,000. If you had 1 dose of the vaccine, 1 in 32,000. If you've had 1 dose, so let me get this right. So that's no vaccine there. So if you've had no doses of vaccine, it's 1 in 16,000. If you had the first dose, it's 1 in 32,000 chance that you'll get the infection tomorrow in 24 hours. And if you've had your second dose of the vaccine, it's 1 in 100. It's 1 in 46,000 that you'll get the infection. But of course, if you've had the first dose of the vaccine, you're going to get it milder with less symptoms. And if you've had 2 doses of the vaccine, you get it even milder with 0 to 1 symptoms. Or 0 to 1 symptom. So, he seems to like to put those numbers in, which is fine. I think it's useful. And he agrees Europe's about 1 month behind the UK. So that's where we're at. One last thing to note, Taiwan. Now, we have been following Taiwan on and off. They did remarkably well at the start of this pandemic. And they anticipated the pandemic, basically, whereas we didn't. But now there are 206 cases in the last 24 hours in Taiwan. And these are community transmission cases. Now, I'm expecting the Taiwanese authorities to get on top of these, but pity that they've done so well for 18 months and now they've had 206 cases in the last 24 hours. I don't know what the vaccination status is actually in Taiwan, but I suspect it's pretty good. They're a very organised grouping. I haven't showed any pictures for a while. I'll have to put some together. But this is Nikki, who's in Thailand, I think, getting her vaccination in exactly the right place by the looks of it. So that was good. Now, I ummed and ahed about this, but seeing I've mentioned it, I think I'll show it to you. It's probably too frivolous. I mean, this is a serious. I'll stop talking. I'll show it to you. Well, this is my first pint of proper English real ale outside a proper pub in, I can't really remember. Probably about 14 months. So it's been nice. It's been a long time, but it's nice. Cheers. End of clip. Oh, well, there you go. That was when the pubs opened and you could drink outside at a social distance, in a social distance way, of course. Okay, that is us for today. Thank you, of course, for watching and have a good rest of your Sunday.